So a lot of people always ask, if this is such a great procedure, why isn't it covered by insurance? And what I'd like to do is add context. Traditional orthopedic medicine, they're the fire department, right? They have axes and fire hoses, drugs and surgery. And in a period of crisis or emergency, those tools are the most appropriate things for us. However, once the fire's out, after they've got there and saved the life of your house, axes and fire hoses aren't going to rebuild the house, right? So it's a different set of tools in a repair and maintenance model. Now, with that being said, how does insurance play into that? If you think about insurance in other areas of our life, we carry insurance for periods of crisis. Homeowners insurance, car insurance, they don't pay for things to maintain our house or to make our house better or to, do basic repairs. It's typically if there's a crisis event, then we carry insurance for periods of crisis, and that makes total sense. We should always offset risk with insurance. That's what it's designed for. Now, what we've been led to believe in terms of Western medicine is that the crisis model is the only healthcare system that applies regardless of circumstance. And what I would tell patients that is, if you choose to work in that model, then you will continue to get progressively worse if you have a chronic illness. So the example is very simple, like diabetes. The primary objective with diabetes is evaluation and management and managing blood sugar, but blood sugar is a symptom of diabetes. It's not the primary issue. 90% of diabetics will die with end-stage complications, and the quality of their life will be very poor. Now, the same thing is true for joint-related issues like osteoarthritis or degenerative processes. If we just manage symptoms, the likelihood that they're going to enter the end stage of that disease and need a replacement surgery or another surgery for that matter is extremely likely, because the nature of that condition is that it's progressive. So if we try to manage our situation, if it's chronic and degenerative, specifically with crisis care tools, then just understand that the clinical outcome or the outcome of that process is essentially going to be not what you want. So if you decide that you want something different, then it requires repair and maintenance tools. So again, back to the example of the diabetic patient, if we choose to be non-diabetic, your insurance is not going to pay for wellness and lifestyle medicine or functional medicine for that matter. It's not designed to. It's designed to pay for axes and fire hoses. The same is true for regenerative medicine, and it doesn't necessarily mean that these types of procedures are considered experimental or they're unproven, or that because the insurance doesn't pay for them, they're not as good as what we have in the traditional model. None of that is true. We are not allowed to provide experimental procedures in the United States. That would be against the law. We have tons of literature for the procedures that we provide. The issue is it's a completely different paradigm. And what I typically tell patients and what I'd like you to consider is this is not an expense. You know what's an expense? An expense is a high deductible for a surgical procedure that's going to fail long term and keep you in pain forever. At the end of the day, this is an investment in health. So if you want to be healthy, you must actively participate, invest your money, invest your time, and then obviously sift through all the crap that's out there and all the hope and all the things that people try to sell. And I get it. When we have a chronic condition, you get bombarded with all kinds of ads and all kinds of things that tell you that they can solve problems and do this and do that with lotions and potions and procedures and all kinds of things. The first and most important thing is educate yourself, find out what you feel most comfortable in terms of what can provide you with the outcome that you want. And then ultimately, if there is an expense associated with it, consider that to be an investment in your health. Or at least, in a spine procedure like this, it's an investment in knowing that you've tried every conservative option before you go and do the most radically invasive thing that is permanent and can't be reversed. And if we see that, again, as an investment so that, we can live a long, healthy, and productive life, then I think it changes sort of how we look at things. Now, with that being said, obviously there are costs associated with it, and we do everything we possibly can with payment plans. We have a payment plan pretty much for every patient that comes through the door. We try to do the best we can to make it affordable for each individual, because we really want to expose patients to this style of healthcare so that we can get more people well. We have specialists that are well trained in this type of procedure. There are costs for materials, there's costs for the outpatient center, sedation costs. So some of those things are something that we can't get around. But outside of that, we try to make it as affordable as we possibly can for each individual. I know that in the marketplace, depending on where you look, there's a wide range of cost for Discseel specifically. And one thing that I'll just kind of mention in regard to that is when we do a Discseel procedure, it is not simply a Discseel procedure. We always add other components to the process. It is much more comprehensive than just addressing discs. Along with that, we always want to take care of the functional integrative component, essentially the diet and lifestyle portion. Patients are open to it. We can do peptides and hormones and all kinds of things to help improve the outcome. But again, remember that, we'll do everything we can to work with you on costs that make sense or that fits into your budget. If in fact, your goal is long-term improvement and you want to take part in these services, we'll do everything we possibly can. Our objective is to expose as many people to modern medicine in a regenerative environment as we possibly can. And we're always here to answer questions and do the very best we can to help as many individuals as possible.